Hello, and welcome to this presentation. My name is Arely Herrera, and today we will be talking about asthma. So, what is asthma? It is categorized as a chronic inflammatory obstructive disease of the airway. It affects a person's ability to inhale and exhale and keeping a proper balance of oxygen in the body. Typical symptoms include shortness of breath, wheezing, tightness in the chest, and persistent cough. According to the American College of Allergy, Asthma and Immunology, about 26 million Americans are affected, and it is the leading cause for children and adults to miss school or work. It is estimated that asthma is higher in incidence in children and women and are most affected compared to their counterparts. Let's explore the normal airway. As air enters the nasal passages aided by the contraction of the diaphragm, it is filtered throughout the nasal passages of pharynx, the larynx, the trachea, and lungs. Inside the lungs, branches called bronchi divide into bronchial tubes and finally into the alveoli. As air is pushed into the bronchioles and into the alveoli, carbon dioxide and oxygen are exchanged by diffusion. Now, let's talk about asthma. There are two types of asthma. The first one is intrinsic. This type of asthma is less understood because the antibody IgE is not involved in the inflammatory responses. It is believed that it has a genetic component and thus is less understood. The second one is extrinsic, which is mostly caused by environmental factors and exposures. The antibody IgE is present, and this antibody is responsible for many of the inflammatory responses in asthma. Also, it is more widely studied and understood. In this presentation, we will be talking about extrinsic asthma. The anatomy of asthma. Well, as I mentioned before, when allergens are recognized by immunity factors such as IgE, T lymphocytes, and neutrophils, IgE initiates a cascade of events where mast cells produce histamine and release it into the smooth muscle of the bronchioles, causing inflammation and obstruction of the airway. Another process that occurs while the allergens are being engulfed by macrophages, it sends a signal to the goblet cells found in the epithelium layer of the inside of the bronchioles to produce excess mucus, further narrowing the airway. In this picture, we see how a normal airway compares to an asthmatic airway during an attack. We see inflammation, overproduction of mucus, and contraction of the smooth muscles surrounding the bronchioles, leading to a decreased diameter of the lumen in which air can flow. Here, we see how contracted an asthmatic airway looks like, leading to shortness of breath and wheezing, and ultimately dyspnea or anaphylaxis if it is severe. Let's talk about the causes. Many allergens that are in our everyday lives, such as pet hair, mites, and cockroaches, medications, mold, stress, cold air, among others. Also, the fact that we now live in more urban areas, pollution is also a factor that causes asthma in many individuals. How is asthma diagnosed? While there is no specific diagnosis procedure, when coughing, wheezing, chest tightness, and breathlessness are present in a patient, he can easily be diagnosed as asthmatic. Another technique that is used to see how the flow of air is affected by an asthma attack is called spirometry. Using the spirometer, the patient blows and the flow of volume is measured to see the capacity of the lung. Asthma can be treated by avoiding triggers altogether. However, for some individuals, avoiding pollution or pollen or any environmental factors can be challenging. There are medications such as antihistamines that help patients avoid or decrease the inflammatory responses in the smooth muscle. This medication has to be taken on a daily basis by individuals that have mild asthma and are exposed to the allergens for a long period of time. Also, there are meter inhalers to help patients with acute attacks, such as albuterol that relaxes the smooth muscles surrounding the bronchioles. Another type of inhaler is a corticosteroid inhaler that is used on a long-term treatment that decreases the inflammatory response in the smooth muscle layers of the bronchioles. There are also nebulizers that help patients decrease swelling and help with the mucus production. Thank you for watching.